Other news now, a lot to get to. The former head of the Centers for Disease Control and Prevention, Susan Menarez, testified in a closely watched hearing yesterday, just weeks after her firing last month by HHS Secretary Robert F. Kennedy Jr. NBC News correspondent Ann Thompson reports.
I believe preventable diseases will return, and I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough.
The stakes laid bare by fired CDC Director Dr. Susan Menarez over the future of the nation's vaccine policy. In August, 29 days after he called her scientific credentials unimpeachable, Health and Human Services Secretary Robert F. Kennedy Jr. dismissed his handpicked Senate-confirmed choice over vaccines.
He just wanted blanket approval.
Okay.
And if I could not commit to approval of each and every one of the recommendations that would be forthcoming, I needed to resign.
Menarez told the Senate committee she refused to pre-approve the decisions of a vaccine advisory panel without science or data. Several new members of that committee, selected by Kennedy, share his vaccine skepticism.
I was fired for holding the line on scientific integrity, but that line does not disappear with me.
2 weeks ago, Kennedy told another Senate committee Menarez lied about her firing.
Medicaid will tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no.
Menarez also said Kennedy disparaged the nation's top health agency.
He called CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He said that CDC employees were killing children and they don't care. He said during the COVID outbreak, CDC told hospitals to turn away sick COVID patients until they had blue lips before allowing them to get treatment.
Menarez said Kennedy's assertions are not true. Some committee Republicans zeroed in on the COVID vaccine.
Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't.
Doctor and committee chairman Bill Cassidy wants to hear from Kennedy himself.
I think Secretary Kennedy has to come and address this specifically.
Ann Thompson reporting there. The CDC's Advisory Committee on Immunization Practices, composed of 12 Kennedy appointees, is set to meet today and tomorrow to vote on vaccines for measles, COVID, and hepatitis B. Former CDC Chief Medical Officer Dr. Deborah Howry testified alongside Menarez and said the committee may recommend delaying the hepatitis B birth dose until age 4, despite no supporting data for that move. Howry warned if the vaccine schedule proceeds as planned, the U.S. will, quote, see kids dying of vaccine-preventable diseases. She called on Kennedy to resign. Joining us now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, good to see you as always. So what are your thoughts, your concerns perhaps about what recommendations may be coming from this new panel?
Well, good morning. You said it in the tee-up. There is going to be a revisiting from this new group of advisors on this advisory committee for immunization practices on 3 vaccines. That's what we're expecting, and sort of pre-bunk it to some degree. This is the measles, mumps, rubella, varicella combination vaccine that we don't talk a lot about. It's also the hepatitis B vaccine, as you pointed out, and COVID vaccine for children. The chilling effect here, Willie, is, if we were, for example, delaying the hepatitis B vaccine in any absence of any reason to do so, there's a reason we give it at birth. It's the so-called birth dose. Within the first 24 hours of life, we give this vaccine. And what we've realized is that it's important to give that vaccine right within that first 24 hours because babies get exposed to hepatitis B from any number of potential risks. Mom, potentially, if she wasn't screened later in her pregnancy. And why does that matter? 90% of children that end up getting infected with hepatitis B in their first moments of life end up developing chronic liver disease. It's a lifelong condition, not much you can do about it. So there's a rhyme to the reason of what we do. It's a very safe vaccine, and we can go through all the data on why. But really, the fact that Rand Paul, he was really, and RFK, they are the drivers of revisiting these things that no other country in the world is revisiting. But that's the concern here. And I might add, let me just point out, health systems really across the country, my own health system, while Dr. Monarez was speaking yesterday, I got an email from my health system saying, we are going to recommend for all of our patients no changes to how we vaccinate for the respiratory viral season. America's health insurance plan said we're going to continue to cover vaccines. So there is civil society stepping in saying, you know what, we don't care what's going to happen the next 2 days. We're going to keep things as usual.
So as you said, the hepatitis B vaccine, for example, is given to newborns, and now this panel led by Kennedy wants to delay that to 4 years old. Let's just take that one vaccine as an example. Is there some new data? Are there some new medical revelations that would recommend this change?
No, and let me try to channel the contrarian view. Why are they saying this? They want to take us back, Willie, 30, 40 years ago, where they're recommending only give the vaccine if, say, mom or child might test positive. And that's what we used to do 40 years ago. We missed a lot of kids that needed the vaccine because we just didn't, screening isn't effective. You don't screen everybody. For example, mom usually has to get screened at 8 weeks of pregnancy, but there's a lot that can happen between 8 and delivery, and they can get exposed. And so there's a lot of imperfections from this screen and then vaccinate framework that we did 40 years ago, Willie, that has fallen into disfavor because we missed so many kids. And that's the expectation. The expectation is now if they remove the birth dose, here's why this matters. Vaccines for kids, for children, VFC, it's a Medicaid-funded program, Willie. Half the kids in this country get their vaccines funded at zero cost through that program. So while a private insurer is saying we're not going to make any changes and we're going to continue to fund vaccines, Medicaid is very much accountable to whatever ACIP does. So if ACIP says we're going to change the hepatitis B vaccine, it's no longer going to be covered.
NBC News medical contributor Dr. Vin Gupta, thank you very much. We'll stay on this with you. Thank you.